Thank you very much. Dr. Rice, you're here from Harvard Medical School. People are getting sick, are they not? And they're not getting sick the way Harry Alford is getting sick. They're really getting sick, aren't they? And so maybe you could bring to us a little bit of your information about the increased hospitalizations, the respiratory related diseases, all of the things that are actually implicated in having this additional pollution in our atmosphere. Can you talk a little bit about how it is impacting, especially children in our country?
Certainly. Thank you, Senator Markey. This is certainly an area where I feel that I have a lot to add to the discussion because I'm a lung doctor. I take care of patients with lung disease, and I also study air pollution when I'm not taking care of patients. And in addition to my personal observations as a doctor, when I see patients come and see me more often because the pollen level is worse, or the ozone levels in Boston sometimes can get very high on very hot days, we also have the observations of the physicians of the American Thoracic Society, the survey that I mentioned. And the doctors completing the survey, the vast majority of them commented that they personally observed that their patients' lung function is worse. Their symptoms are worse during high air pollution days.
There are real implications for the 12 million Americans who already have respiratory illnesses, huh?
Certainly. And we can look back at the incredible success story of the Clean Air Act. The reductions in air pollution as a result of the Clean Air Act have been astounding, and we've really come a long way. And when we look back, researchers look back at the health benefits of the Clean Air Act, they've been astounding, not just for respiratory illness, asthma symptom control, but also mortality and heart disease benefits.
And you mentioned your own son earlier in your testimony, who has a respiratory illness, huh? So what could just additional pollution that we send up there, uncontrolled, mean long-term for him and for those others and millions of victims across the country?
So there's a variety of sources of air pollution, and one of them is the power plants and through the burning of greenhouse gases. There's also traffic and other things. So the reality is that if we do not do anything about greenhouse gas emissions, the EPA report looked at just that piece of the pie and found that ozone levels will increase, predict that we actually have increases in ozone, whereas ozone levels have actually declined, and we've experienced health benefits as a result of those gains.
So, so thank you for putting that out there. So there's real sickness, not metaphorical sickness, that is occurring because of global warming. And you, Mr. Martins, you're here, you're representing New York, but you're representing one of the RGGI states, the Regional Greenhouse Gas Initiative states, all of New England, those 6 states, New York, Maryland, and Delaware, 9 states. They band together, and over the last 7 years, Massachusetts has actually seen a 40% reduction in the greenhouse gases that we're sending up, while we've seen a 22% growth in our economy. So can you talk a little bit about that virtuous cycle that seems to elude the observation of those who are critical of our ability to be able to increase the health and of individuals and the economy simultaneously?
Yes, Senator, thank you. As I said in my testimony, the RGGI experience has been an extraordinarily successful one. We had an independent study done by the analysis group that quantified the benefits over a 3-year period from 2009 to 2011, $1.3 billion in reductions in bills over the RGGI region, $1.6 billion in extra or incremental economic activity. It's been an extraordinarily positive experience. All the while, as you said, the region has experienced economic growth. We've reduced bills. We've reduced bills for low and moderate income families, especially, and the beauty of the RGGI approach is that...
Say that again. You've reduced the electricity bills for low and moderate income people. That
Yes,
seems to contradict
the
earlier testimony.
cumulative benefit to just New York low and moderate income bill players has been $60 million to date through the first quarter of this year. And those are going to keep, those benefits will continue on into the future because New York has specified in 2 of its programs income-eligible patients, income-eligible ratepayers. So again, the beauty of the program is that states have the flexibility to target the revenue from the sale of those allowances to a variety of programs. So industrial customers can benefit, low and moderate income ratepayers can benefit, businesses, your average homeowners. So it has been a tremendous success story.
And it's
Senator,
my
as you said.
understanding, Mr. Martins, that under the proposed rulemaking, that, for example, New Jersey or Pennsylvania could join our regional greenhouse gas initiative.
We hope they do.
And
We hope they
already
do.
and plug into an already existing system that is working.
Yes.
That is lowering costs for low and moderate income, lowering the amount of greenhouse gases while seeing tremendous growth in our GDP. So I think that there's a reason to be very optimistic about our ability, listening to the Pope's admonitions to us, that we should be the global leader on this, and we can use market forces to accomplish the goal while still enjoying tremendous economic growth and taking care of the poor and the moderate income people in our country.
I agree with you entirely, Senator. I think there's places around the country that could benefit from that model. It may not be identical to the RGGI model, but certainly states cooperating makes great sense because the efficiencies of dealing with multiple states and energy systems that cross state boundaries has obviously been a great advantage in the RGGI states, and I think it could be elsewhere.
And I'm just afraid that too many people are just pessimistic in general. They're just not optimistic about our ability as Americans to be the global leader, to use new technologies, to invest in the future and protect young people and our economy at the same time. And they unfortunately harbor a great doubt about our country's ability to do that. But I thank the 2 of you for your testimony because you point out the problems and the solutions. And you've all done it in a way which I think should really give people some hope. Thank you, Madam Chair.